Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 1-866-870-5752. That's 866-870-5752. Remember to check out the website at www.lastemcells.com. That's lastemcells.com. And right now we are speaking with Jamie.
Hey, Jamie, are you still with us?
Yes, I am.
Good girl. Thank you so much. So what we're talking about motivation and what I do to motivate myself. And I live my life in a state of continual motivation because this planet is one of gravity. Everything from the time of our birth is pulling on us and, in a sense, breaking us down, unless we continue to uplift. And the work I do in regenerative medicine, which is using cells from your body to regrow tissue, as I think about it, I mean, this is the first time I've had this thought in my life, is very similar to how I live my life. And it's amazing that I chose this field because it augments the way that I tune myself up. I've done it with my own cells and prolotherapy in the old days and PRP more recently and stem cells more recently to rebuild the tissue in my own body. I inject myself. If it's on the front of my body, on the back of my body, I find another guy like me when we go to national meetings to inject me. But it's an amazing process of the tissue regrowing instead of cutting it out with surgery. So the old way of doing things is to cut tissue out. And this book that I'm going to give you a copy of for calling in, Jamie, which is about stem cells and platelets, and the byline being regenerate, don't operate, is all about how you regenerate the body. But what I want you to do, besides regenerating your body, is to consider regenerating your spirit. How do you do that? How do people do that? How do I do that? How does Nita do that? We do it by talking to ourselves all day long. And the fact that you were so kind to talk about your weight issue, and I want you to know we have a diet for you. It's called the Ideal Protein. And you would probably lose about 15 or 20 pounds a month on that. No one has failed that diet. So it's something I want you to consider as a way of getting your life the way you want it to be, and your anti-aging program. You can tell me to shut up anytime you want. I always tell my patients that, because I do push people a little bit. And I'm pushing you, Jamie, to do an amazing thing for yourself, which is to lose some weight. I know you've probably struggled with it for a long time or your entire life. But I'd love for you to save your knees and your feet and your ankles and your toes and your legs and your hips. And they're on the way down if you weigh that much. And you know that. And you have a great attitude. I can hear it in your voice. So that is the first step, is attitude, obviously. And you've got that. Now it's just doing something about it. So I beg you to get a hold of me. Go to the website. You can email me from any page, www.lastemcells.com. I will email you back the same day, okay? I promise you. And I'd love to make a connection with you, even if you don't come in the office, to just help you get things together. Is that okay?
Jamie, are you there? Oh, I guess we lost Jamie. Sorry.
Well,
thank
Richard
you for your call,
waiting.
Jamie, wherever you are. Okay, let's go to Richard. Here we go. There we go. Oh, I'm calling back.
Hi, Dr. Darrow. I
Hello.
spoke to you just a few minutes ago. I have a right hip problem.
Oh, yeah.
It's a cartilage problem.
You're the
And I forgot to ask you-
70-year-old guy.
That's me. And I forgot to ask you one important question. If I get stem cells, how long do the results last if they're successful?
Well, that's a great question. There's a lot of words in there that I don't know how to define exactly. One is successful, and one is how long. When we do these treatments, we're growing tissue. How long does the tissue last? Well, how long did it last the first time when God made you?
Long time.
Long time. So what does successful mean? What's successful to you may not be successful to me. I want to be 100%. You may be happy with 25% better. Do you understand what I mean?
I do.
So that, I mean, this is strange. In one day, 2 patients in a row who came in, both had one stem cell treatment. And I have people come back every 2 weeks. So they came back, and they came back on the same day. And one said they were 25% better. And I said, well, do you want to do another treatment today? And they said, no, I'm good. And I go, what do you mean? You're only 25% better. And they said, that 25% took the edge off my pain, and I'm totally functional now. All right? So what does that mean? It means a lot of things. Number one, maybe they didn't need to get 100%, but maybe 25% is really 100% for them. I don't know, because it's all psychological and subjective. So the next patient came in. She had a hip shot and had arthritis in her hip. She said she was 97% better. And I said, well, it's been nice knowing you. It's been great. And she said, what do you mean? I want another treatment today. I want to be 100% better. So do you understand how I cannot be the person to judge how long or how successful? It's up to the patient to decide.
I do. I understand. Thank you for that.
Yeah. I can tell you on my own body, the first thing I had injected was my wrist. Someone else did that for me the first time. I was 50% better overnight. I then did it myself about 3 or 4 or 5, I don't remember, over the years, a few more times. And I don't remember having wrist pain. Okay, I know it was there at some point, but it's been so many years that it's healed. Now, could I injure it again and have pain? Of course. I injured it the first time. I hit the ground with a golf club at 100 miles an hour. I didn't even hit the ball. I chunked it, as they call it. So
Sounds
sure.
like you need a golf lesson.
You're not kidding. But you know what's sad about me is now I'm down to a 17 handicap. I was a 12 when I was younger. I don't get to play enough, but I'm a 17. But I take 2 lessons a week from 2 different teachers. I go to Golf Tech. I love them. I have a lesson every Wednesday night, and then I have a lesson at Mountain Gate Country Club by my teacher Gordon, usually on Saturday. So I have 2 different guys working with me. My swing gets better and better, but my score is not getting that much better too quickly. Golf is a strange game.
Maybe stem cells will work for your golf score.
Well, I think so. I mean, my score is coming down. I shot a 44 last Sunday for 9 holes, and that's better than the typical 50. When I go out today, we'll see if I still have the tricks that I had on Sunday. You know, golf is one of those things you think you finally moved in a direction that's amazing, and you go back and it's gone. So we'll see what happens.
No, I play myself, and my score goes up and down.
Yeah. I think I'm better because I learned some great shots, and my putting has increased amazingly. And if that stays, I'm in good shape. Poor Tiger.
Tiger Woods said too.
Tiger better look out. Here you come.
No, he just lost. He didn't make the cut. Poor guy. I was rooting for him.
Exactly.
All right. Well, God bless you, Richard. And, if you want to come out and play golf with me, just go to the website at www.lastemcells.com and email me and I'll take you out.
It sounds wonderful, Dr. Darrow. It was nice speaking with you.
All right. God bless you.
Thanks for your call, Richard.
You too. Bye-bye.
Well, that was nice that he called
Wasn't
back.
it? Yeah.
Yeah, that was lovely. And if you'd like to give us a call, remember the hour is running out. 866-870-5752. That's 866-870-5752. And we are here Saturdays at 10 a.m. and at 1 p.m. And when you phone in, which I would love for you to do right now before we run out of time, you get Dr. Darrow's latest book called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. That's a real important concept, regenerate, don't operate. And please check the website out at www.lastemcells.com. That's lastemcells.com. You can see Dr. Darrow performing the treatments on video, as well as being able to email him off of every page on the site. And if you prefer the ebook over a physical book, you can request that in an email off of the site, which is, again, lastemcells.com. So do give us a call, 866-870-5752. I think people are listeing, and they want to hear you talk, and so they don't want to call because you're interesting. That's what I think is going on. So call.
Yeah, we talk about knees as the most common, back pain, shoulder pain, hip pain, but we get a lot of people that come in, believe it or not, for TMJ. That's what is it called? Do you know?
Mandible,
come on.
jaw.
Tempo.
The temple, mandible, jaw.
You're close. Tempomandibular joint. TMJ. So if you're having pain in the jaw, clicking, things like that, that could be TMJ syndrome. And we do quite a bit of it. And it brings up an idea for me that I want you to know about, which is, what are the reasons people fail my treatments? Okay, so I had someone tell me yesterday, I did TMJ PRP on them, or maybe it was stem cells quite some time ago, and it didn't get better. So some of the typical things that keep a person from healing, number one are overuse. So we get athletes who come in, and I'll work on part of the body, and then they go back and they'll use that part of the body and not give it a chance to heal. Okay, that's number one. Number two, people take anti-inflammatory medicines like ibuprofen for headaches. But if I inject you and we're growing tissue and you take an anti-inflammatory, it's going to block the inflammation that's needed for growth of tissue. And then the final thing is, I like to treat people every couple of weeks. I have people who come in, they'll get a treatment every 6 months and say they didn't heal. Well, there you go. Listen to your doctor. Don't cheat on me. The stuff I do works if you work it. But you got to partner up with me and work it. I can't do the whole thing. I can't put a webcam on your knee or your TMJ or your neck and watch what you're doing. You've got to partner up with me and do the work. And the hardest thing for people to do is not exercise. And there's not one person who comes in who says, "Thank you for telling me not to exercise, doctor." They say, "Well, I don't know if I can not exercise. I've got to. That's how I live." Then we hear the people that go, "You want me to lose weight, but you don't want me to exercise? I need to exercise to lose weight." Well, that's not true. You need to cut out your carbohydrates. Use our diet. Use the ideal protein diet. We don't want you to exercise when we do that diet. Isn't that a strange one? Yeah, there's a lot of strange things that help people heal. And the thing I tell every patient is, Healing is inconvenient. Losing weight is inconvenient. Health is inconvenient. If you look at it that way, I don't.
Well, that's because sometimes things don't make sense because of what we were previously taught, but these are new paradigms and new ideas, so we have to come in open-minded and give it a chance.
So
Would you like to go to Angie?
I do, but first I want to finish up this TMJ. What kind of cells do you use? What kind of stem cells? You can use pretty much any proliferant. You can use PRP, which is platelets that we take from your blood. You could use bone marrow from your pelvis, and you can use cord blood stem cells. Those are the three I do. Some people use fat. I don't use fat because it's an abusive process on the body. I started out doing that first, and I have to use a very thick needle to inject fat. The FDA does not allow us to use collagenase to thin out the fat. Some guys do that. The FDA, if they find out, they're going to take their license away, so I don't do that. So if I'm going to inject your shoulder as an example, I'm going to inject it all over the rotator cuff, into the joint, and in the subdeltoid bursa. You don't want an 18 gauge needle poking you. It would look like hamburger meat. You want to use a thin needle. So bone marrow or cord blood is the way to go for me. So Angie, your daughter has type 1 diabetes. Any solutions other than insulin? And the answer to that is I don't know. I don't deal with diabetes other than to put people on a diet and get rid of their carbs and lower their insulin like that. Getting rid of type 2 diabetes is easy, but if your daughter has type 1 diabetes, I don't have the answer to that. I'm sure there are studies being done at universities, and you can Google and just put in diabetes, stem cells, and university research. And I think you'll find the answer you need. If you need help with me assisting you on that, go to my website, www.lastemcells.com, and email me from any page, and I will get back to you. I'll help you do the research you need to do. We do research in our office. We've got 20 researchers, but it's all musculoskeletal. It's not metabolic, it's not organ system based, it's just about the joints and tendons and ligaments. Okay? So
Okay, I do have a second question.
Sure.
My son is 21, and he's about 6'5", and he's very skinny. And I was concerned, because we have diabetes in our family, and I didn't know if he had lupus or something like that. They said his white blood cell count is fine. Is there any way that we can test him and find out, he can't gain weight. No matter what he does, he can't gain weight. And I didn't know if there's something wrong or if he's just always going to be skinny.
Well, you didn't tell me how much he weighs.
He weighs about 170 pounds, and he's 6'5".
Off the top of my head, without knowing him, I'd say that's perfect.
Okay, so we think he's okay.
Well, like I said, I don't know the answer, but being thin is in, and he may not have hit his growth spurt yet, but there's a lot of testing that doctors can do on him to see if he's okay. And if you want to email me, you can do so through the website. Every page on the website has my email, which is www.lastemcells.com. Does your son look healthy other than being thin?
Well, he was diagnosed with acute pharyngitis yesterday, so he's on antibiotics. But
yeah, but that's not what I mean.
Yeah, he just looks healthy other than just being really skinny to me.
Yeah.
He's just really thin.
Yeah. Well, he's probably very healthy, but I would certainly get him checked out. If he's getting sick frequently, obviously you want to get him checked out. There are so many potential diseases that a person could have. If it was my son and I were concerned, I would send him, to an internist and a rheumatologist to look for different types of things in his blood.
internist and a rheumatologist.
Yeah.
Okay, and I did have chelation done on him twice because he works
Yes.
with metals, and we thought maybe it was metals, and they did find a lot of metals in his body. So I don't know if that's still going on, but I was just
Well,
wondering if there was...
everybody has a lot of metals in their body. That wasn't just him.
Yeah. There were the bad kinds. I don't know.
We all have bad kinds. Yeah, we have heavy metals in
They
us.
said that might help him. I don't know if it did or not. I was kind of hoping it would.
Well, it's a good thing to do. I've chelated myself to get rid of heavy metals, and
Well, I'm wondering maybe that'll help my daughter with diabetes. But I'll do your I'll take your advice and I'll do some googling.
yeah.
I think all the doctors I've gone to have just seem to think that less carbs and more insulin is the solution, but there just seems to be more to it than that.
Well, feel free to email me, and I'll be glad to assist you in your search for doctors and research.
Okay. Thank you, sir.
God bless you, Angie. I'm so glad you called.
Thanks for your call, Angie.
Bye-bye. Thank you. Bye-bye.
Bye. Okay, our number is 866-870-5752. That's 866-870-5752. And I bet you have another question there.
Are you kidding me? Another? I have,
You have millions,
endless.
I know.
All day long I get emails and questions from people. So this one says meniscus. Let me see what they say about it. I suffered from a medial root avulsion of the meniscus in my left knee while playing soccer. It was repaired via a tibial tie-down procedure in March 2017. However, I still suffer from moderate to severe pain after over 2 years post-recovery. I would like to explore umbilical stem cell therapy so I can have my life back again. Good idea. When I do umbilical cord stem cells, I mix it with your platelets from your blood, and that would probably be the way that I would go to heal this knee. I need to do an exam on anyone that I work on. I don't care as much about what an MRI or an X-ray shows, because it doesn't necessarily tell me the pain generator. So I had a wonderful couple come in yesterday, and the gentleman had a terrible looking knee on MRI, and I examined it and I said, "You have one of the best knees I have ever seen." And he couldn't get his MRI out of his mind, and he went on. Literally, I spent an hour with them. I didn't mind it because they're such nice people, showing them and showing the research of why the MRI doesn't matter. It can be helpful. There we go, Nita. God bless you, Nita.
Oh,
You're
my
a great
goodness.
host, and thank you, callers, and
Well,
thank you, staff.
Thank you. And thank you, Alex and Nick, and everybody behind the scenes here at Living Pain Free. Remember to listen to The Pet Show with our friend Warren Eckstein from 11 to 1 every Saturday, and grab a pen or a pencil, write down this important information about to come your way. I'm Nita Valens. Thanks for listening, and we'll see you next time.